Warning, the following episode may contain explicit language. If that's not bad enough, we're going to do Russian accents. Apologies in advance. Isolated at Novolavrovskaya, nailed it, station in Antarctica in 1961, a young surgeon on expedition for Soviet Russia begins to develop abdominal pain and realizes he has developed a major problem given his circumstances.
Dr. Rogozov, are you ever going to come out of your room? We missed you at the dinner table.
Sorry, comrade, I do not feel well. I would like to be left alone, if at all.
You need to eat, Doctor. Here, I brought you some
No, thank you, but I don't have the appetite for.
borscht. Fresh, ice-cold borscht. Just what we need here in Antarctica. Well, it's easy to store that way, at least.
I don't think I can stomach any more borscht. Well, is that what we have to eat here?
Good question. Feels like cheap stereotype.
It does.
But then, have you had much to drink? It is important not to become dehydrated.
I've had some water. I keep vomiting. I think something is wrong with me.
Nonsense. Let me take temperature. There we go. See? Just shy of 104 degrees. It could be worse. What's a little fever?
Was that in Celsius? I feel like we use Celsius.
So true, comrade. Da. Who in the civilized world does not use Celsius? You know what my grandmother used to give us for fevers?
I really appreciate this, but
Ice cold vodka.
that can't be true.
No, it's true. I swear on my babushka's babushka.
I think I'm beginning to be offended by this exchange.
I'm sorry. Let's change the subject.
Very well. I will tell you, I'm concerned something is wrong with me. I am a surgeon, you know. Developed worsening abdominal pain. I'm tender over my appendix, and I will need a surgery.
But where will you get this surgery, comrade? There is no hospital here. You know that. The boat left 2 months ago. It won't be back until after the winter season.
How long does the winter season last here, comrade?
In Antarctica? 14 months out of the year.
That is not possible.
You'll find time passes very slowly here.
No, I refuse to give up. I will not let this appendix rupture. I will not be restrained to this fate. I must survive this. Comrade,
Yes, doctor?
prepare for the operation.
What operation?
I will operate on myself. I will open my abdomen, locate the appendix, and remove before I die. I have no choice, comrade. Please, go get help.
But this is madness. You are only doctor. You cannot do surgery on yourself. What if something goes wrong? Think about the rest of us.
I am, comrade. But if I do not do this, I will die, and you will be in trouble anyway.
Okay. I understand. This is serious problem. Drastic solution. I think I have another idea.
What other idea could there be?
My grandfather was a doctor.
I don't follow.
He said that laughter was best medicine.
I don't like where this is going.
You know what they say.
Please, no.
In Soviet Antarctica, appendix takes you out.
On second thought, I welcome death.
I will do better with next jokes.
Hopefully, I will be dead by then.
Poor historians, poor historians. We look at cases through our history. It's just Max in there and Mike and me. You gotta listen, you don't have to read. Poor historians, poor historians, poor historians.
Welcome, everyone. This is Poor Historians, a podcast delving into the archives of medical history. As three practicing emergency physicians, we will explore the unusual ailments, treatments, physicians, and all related material having to do with the healing arts. I'm Max, and I'm joined here by my good friends and colleagues, Aaron and Mike. Gentlemen, would you say you have a high pain tolerance?
Duh.
No, I don't. No.
I feel like I do.
Now, one time I was in a department store and I sneezed and this caused me so much pain in my jaw. I cried out.
Oh
And all the ladies in the department store like came to check on me. They're like, "Oh my gosh, are you all right?" I got so much crap for that for like my entire marriage, basically.
my
Like,
God.
How old were you when that happened? When you hurt yourself sneezing?
yeah, I was, early 30s. I do not have a high pain tolerance. If I ever come in with some sort of ailment, you will see me coming.
I don't know. I definitely would not say I have the highest pain tolerance. It's actually gotten better since I became a physician, because I guess part of my brain is like, hey, if I have to cause pain in other people, I should be able to take a bit myself. So I'm much better at it. But I wouldn't say I have the highest pain tolerance now.
One time I cut myself with a box cutter on my day off when I was in residency, and I went like partially up halfway up my nail. And I will say that time I held pressure for about 2 hours because there's no way I wanted to go in. I was like, they're going to have to take the nail off, and this is going to be like 3 hours. It's my day off. I'm a resident. This is my only one. I just held that forever, and it healed just fine. I got to say.
You still have all your fingers.
Yeah, right. It didn't fall off. So maybe I'm okay. Maybe I don't give myself enough credit. I don't know.
Mike was just going to tell us how tough he is.
Oh, I'm pretty tough. Yeah, once I passed a 10 centimeter kidney stone, and all I did was chew on some wood chips. No, that never happened. No, but because I was running, like I'd run a marathon a couple years ago. When you run, you kind of learn what your pain threshold is.
Mm-hmm.
So I think that kind of helped.
I mean, you guys play hockey, so you have to be tougher than me, because the only sport I ever played that much was soccer. So
yeah, but we play like beer league old guy hockey now, and there's essentially no checking, and all you do is complain about chronic injuries on the bench.
Fair. That's fair.
At least that's what I do now. Aaron pointed this out, and it's a very apropos shout out, but it just so happens that it is emergency department or emergency room nurses week this week. And
every week is emergency room nurses week.
It is in our department, because I know that many of our nurses who are kind enough to listen to this podcast know how much we appreciate them, I think, or try to make their average day at work much better. I'm sure when they see Aaron and I showing up for shift, they're like, this is going to be an amazing day. And then, Mike comes in.
I will say that I am quarreling with a nurse, and she knows who she is.
You can't call her out like
this
that.
Is a shout out to the nurse that I'm currently quarreling with. And I have no idea why I'm quarreling with her, but there's an issue. She won't communicate with me. You know who you are.
Are you going to get in trouble if I make sure that makes it into this cut?
He's going to get in a lot of trouble.
No, not at all.
If it's who I'm thinking,
we're always going to, the urine's going to be missing. Oh, I forgot to put the hats.
For whoever that nurse might be, I give you full permission to make Mike's life much worse at work.
Yeah, she already does.
Say that with love.
Truth, we could not do our job
does with love.
Mm-hmm. Could not.
Yeah,
true. Very much true.
Yep.
We love you guys, and you know it. All right, so let's set the scene here. It is 1961. JFK has been sworn into the presidency. Germany just closed the border between East and West, started building this wall. The World Wildlife Fund was also started at this time. They did animal conservation things, and more impressively, later defeated the WWE in court to retain the actual WWF title.
Awesome.
All that is exactly true.
That is so good.
And of course, the Russians put a young 27-year-old cosmonaut named Yuri Gagarin into space. And as it would turn out, about 18 days after that historic space flight, his countryman was faced with a big problem in a similarly inhospitable circumstance.
So wait. I want to go back. That WWF logo with the two pandas, I think of that a lot differently now that I know they beat the WWE. They kind of look a little more badass. Have you seen that logo? There's like one panda standing up, and there's another panda like.
Yep, I actually have a T-shirt of that logo, except somebody photoshopped a chair into the standing panda. He was about to give a chair shot to the bent over panda.
That's awesome.
No, that is actually they literally won the WWF title. That was a long haul game.
Wait, I'm not seeing the standing panda.
Are you Googling it?
Mm-hmm.
I think I'm pretty sure. Maybe there's not. Maybe there's just the one.
If I would have thought of that, I would have worn my shirt for the.
I see the one that Max was telling me about. WWF
totally have that shirt.
Panda with a chair.
It's never not funny. So during that time, a 27-year-old Russian surgeon named Leonid Rogozov goes to Antarctica as part of a Soviet expedition. He's among a team of 12 people, and they get stationed at Novolazarevskaya Station.
Nice.
I
Well done.
practiced that. It takes about 36 hours by boat trip to get down there in the first place, and they end up having to leave the expeditioners there for at least about a year at a time because it's very limited when the boat can return. And even though there are planes and such, the likelihood of having the weather to emergently fly in and out as needed is pretty unfeasible, especially at this time. So once they're dropped off, they're there.
Did you guys see that there was a movie, the guy that like ran with the caribous and he went up to Alaska? It's like Never Cry Wolf or something. I forget. I'll have to Google
It sounds like a movie title that I've heard of and I know nothing about.
Anyway, there's a scene of like the up in Alaska, the plane just leaving him with his boxes, and he's just like out there because he's going to be there for like a year. So they leave him all these boxes, and then he's just there in the middle of the tundra. I mean, that's the kind of thing that looks cool when you see it on a documentary, but then when you actually would do it, that would be really lonely.
I've been camping exactly 4 times in my life. And every time we walked away from the car into the woods, I had the same feeling.
The woods.
I think I made it roughly 18 hours on each trip before I had to return to civilization.
I'm a sucker for the Shackleton story, right? They were down there, right?
Yeah, they crushed it.
Yeah.
They did awesome.
Did they though?
No.
I mean, they survived, so yeah.
I mean, some of them did.
Yeah, a few did.
I mean, yeah, they ate a lot of dogs, though. That's not very good.
No, that's not. Jeez, way to bring me to never mind.
Yeah.
Shackleton's an asshole.
A few months into this expedition, Rogozov develops some lower abdominal pain. He gets nauseated, and over a few days, he's getting worse. And since he is a surgeon, he is already suspicious and anchoring onto his own diagnosis. So basically, he slowly develops this abdominal pain, and he realizes he is stranded in the middle of nowhere with likely acute appendicitis. So I figured, probably take a moment. You guys ever seen that diagnosis?
I read about it in a book once. And then I saw 5,000 appendicitis over the course of my 50-year career.
Yeah, but how many times have you made a 1961 diagnosis of appendicitis?
Like clinically?
Yes.
I feel like we...
All the way through. So all the way without CAT scan.
I feel like that's what they wanted us to do when I started, and that was a long time ago. But back in the day, it was like if you think they have appendicitis, you call a surgeon, you have them do their evaluation. Most everybody got a CT scan, but I would say probably 0% of the...
Yeah, right.
I've tried a few times, but no, I've never had...
Yeah, and it makes sense. You know, you got to make sure it's not something else.
They'll take ultrasound now. If it's a good enough story and you have positive ultrasound. But yeah, I think 0% of the time as well. I would try. I'd be like, I got this kid's classic. The pain started around their belly button and it went down to the right side, and they've been sick for 2 days. And when they go over bumps in the road, it hurts their belly and they have a fever. And the surgeon just be like, well, get the CT scan and call me when it's back.
Mm. And you want to clinically diagnose it, and you get the CT scan back, and they have epiploic appendicitis.
Which is
you just don't call them back.
That's one of my favorite diagnoses. Or like a cecal diverticulitis.
Yeah, but I mean, obviously out there, especially at this time, you don't have CAT scanners. You definitely don't have CAT scanners down there. And so he just had to clinically suspect, I think this is what I got going on. And so I also would like to point out, anybody know why we have this stupid organ?
It's to help digest real hearty vegetables, right? Not vegetable, like plant-based things.
I had heard that one.
Because koalas have huge appendices.
Do they?
Yeah.
I always heard it had something to do with the immune system. Something about it's there to present, like it has a lot of cells that recognize pathogens or something. But to be honest, I do not know. And
It's a vestigial structure.
Yeah, I mean, they call it a vestigial or leftover structure. And I actually just was, I too have seen a million cases of appendicitis, but I was like, I don't think I've looked up the most recent thought on what this thing does. And so I looked it up, and I think the most, looks like the most recent thought is that it actually may be a bacterial reservoir of sorts to help with the final digestive steps. But again, it's all speculation.
Huh.
Can't-
That would make sense.
So there's a
Like
little
it's
kombucha sitting in your colon,
yes,
waiting to get
that's
squirted onto your food.
fermenting.
I mean, by that time, I don't think it's called food anymore.
No, probably
I
not.
think it's called
most
Stuhl.
of the way to
Yeah.
pool. Most of the way to poo.
Mhm.
That,
Yeah,
It's
it looks
poo.
you're there when you're
poo-
at the
poo
cecum,
like.
that's for sure.
It's
Yeah.
chew.
So, you guys have mentioned this, but basically in the U.S., the standard of care is that with you diagnose appendicitis, you catch it usually on a CAT scan, and if it has not ruptured, meaning the appendix, this little fingery doodad off the first part of the large intestine, it's in your right lower part of your belly. If it becomes plugged up and infected, it gets inflamed, and then you come in, you see us, we CAT scan you if we have that suspicion, and then the CAT scan usually tells us, hey, that's what's going on, and you call a surgeon to try and take it out. You want to take it out before it ruptures. However, it should be noted that there are some other countries where they approach this completely differently, and it's antibiotics, expect possible rupture, and give it time. I guess I've heard of, I know that these studies exist here in the U.S., but I don't think it's prime time as we like to say.
I heard about a 70% success rate. So I usually tell patients, I'm like, you could do that, but you'd have to stay in the hospital because it's like a protocol. You do it.
Oh, totally.
So
Yeah,
IV
I know, and we're
antibiotics for 2
talking that
days.
it's not just like a couple of pills go home. It's
no.
IV antibiotics and hospital monitoring in the countries that do that.
I don't think I guess that's not what Rogozov wanted to do.
No, Rogozov, he knows he's got appendicitis, but he also knows he's the only surgeon, and there is no hospital there on site or anywhere nearby. And so I actually did find, I had known this story before, but I found this article in the BBC that was pretty helpful. And I will include site at the end of the show. But there was an interesting aside in that article. And so they have this little quote from a gentleman named Dr. Duncan G., who wrote, quote, I was a medical student in the early 60s, and we remember being taught what to do if we found ourselves in the Antarctic with appendicitis. We were told to sit upright with our knees pulled up to our chests. Then, if the appendix did burst, in this position, we had the best chance of pus draining to the bottom of the pelvis
Such a
and
bad
becoming
idea.
a walled-off abscess, rather than infecting the peritoneum, that membrane that covers the inside of the abdomen. Peritonitis can kill you. We were not advised to reach for the scalpel. End quote. That's pretty hardcore.
Everybody's getting a kick out of this.
Just fetal
think it's
position,
hilarious.
upright fetal position, and take it.
That seems like a very British solution.
I would
to
do a
this problem.
headstand so it would collect into my diaphragm. So if it did wall off into pus, then I would start coughing and I'd know it.
That's next level.
Peritonitis isn't what kills you; it's the sepsis from the bacteria in your belly.
I would just do Reiki therapy.
So, sitting in the fetal position waiting for overwhelming intra-abdominal infection is not a very cool story. But deciding to perform surgery on yourself at the bottom of the world is definitely a much better story. So he had decided he needed the surgery, and he was going to perform the surgery lest he die from infection.
Nice.
And he actually, some of his journal writing is pretty amazing, and this is kind of the new way I want to approach asking patients what kind of pain they're in. So Rogozov wrote in his journal, quote, I did not sleep at all last night. It hurts like the devil. A snowstorm whipping through my soul, wailing like 100 jackals.
Nice.
And I would love to put something like that in a chart.
Yes.
I will now officially ask that all patients abandon the how bad is your pain on a scale of 1 to 10 and use poetic hyperbole to describe it from here on out. How many jackals would you say your pain is? So, first things first, he had to ask permission from the commander in charge of the station to do surgery on himself because, what we don't really think about this, if they were to lose him, let alone somebody else on the expedition, it's not good PR. And it's, and certainly in Soviet Russia, and for the most part, the US at that time, any backward scientific progress, be it something localized or something that was reported widely, was not something anybody wanted. And so the article here, again, the BBC article, basically Rogozov's son said that, quote, if my father was to fail and die, it would definitely put a hard hat of negative publicity on the Soviet Antarctic program, end quote. It's all about optics, people. Spoiler alert, he was actually given permission to cut himself open.
That's just very Russian. I'd like to cut into my own stomach. Please, can I have permission to cut in?
But again, he's a surgeon. Like, he's important to them too.
I
If
guess
he goes like, geez,
yeah.
now what?
The way it
Over
feels
here.
Russian to me is like, of course this is happening. The worst things always happen to us. They will always continue to happen. And I'm not going to,
yeah.
it just is what it is. So I guess, hey, can I cut myself open? Because I think that's what'll work.
Mhm.
I mean, there is this
And no nonsense. Yeah.
yeah.
Strangely enough, this is 100% true. My undergrad minor was in Russian history. Because I took one class and I was like, this is fascinating, and then ended up taking them all. And so there
Wouldn't
was
you want to take your time with history? Wait, what did you say? Oh, Russian, not Russian.
God, I don't need a moment. But anyway, so there was a quote in there for, and I might even be quoting my professor, but I think she was quoting somebody else, and it is just that things that don't really happen in Russia. And there was a lot of moments in history. This is tamed by some measures going back to like Peter the Great and things like that. But
oh yeah,
it's the Russian people have endured a lot, and so this like attitude of, you know what, I'm going to take out my own appendix may not be all that surprising.
right.
Well, plus you're dependent on the state. You might as well do it yourself.
Fair. Cheaper that way.
Yeah, where's your
So-
nanny state now? Nowhere near you.
Mhm.
All right. So what'd this
So-
guy do?
So Rogozov meticulously planned his autoappendectomy. So he was described as being extremely detailed in this. He went through each kind of step of the operation out loud. He discussed and assigned roles to other expeditioners. Now, he may not have had dedicated medical staff, so he had to explain to them kind of what to expect at each time. His thought was, I have to do this on myself. I'm going to use local anesthetic to basically numb the skin of the abdomen, make my incisions, and then have his assistants hold lights and mirrors so he can, see what's going on in his own abdomen. And he went so far, he actually had a backup plan in case he died during this. And he had to instruct the assistants to, quote, inject him with adrenaline and perform artificial ventilation, end quote, in the event that he appeared to lose consciousness or, again, died for a moment during the procedure.
When he said ventilation, I thought insemination.
Oh, yeah.
No,
okay.
I wouldn't. I mean,
no,
I was
that wouldn't.
distracted.
Useful, but not in these, not here. Yeah,
Well,
I like
cool.
I wonder, I should have looked up what is 1961 Soviet CPR. I bet it's amazing.
I bet. So, okay, here you go.
Futile.
Ready?
Completely
there's a
futile.
guy-
Hold on, let's just get ready to begin. Cut. Go ahead.
No, it's not going to be that. You'll be able to leave this in there. There's a guy. He's wearing rubber gloves. He's wearing one of those like big furry hats. He's got his
I don't
arms
think I'm gonna
crossed,
be able to leave this in there now.
and he's doing that dance. But instead of like doing that squat dance,
Yes.
he's doing that on the person's chest, perfectly at 100 beats a minute.
It might work. So I don't know about you guys, but I do personally prefer my surgery to be done under general anesthetic. But then again, I definitely prefer not doing surgery on myself. And so Rogozov, he being the only surgeon, could not be knocked out. So he figured he would use Novocaine, which fortunately they had, and would, again, anesthetize his skin so he can make all necessary cuts. And reasonably, Rogozov wrote, quote, I was scared too, but then I picked up the needle with the Novocaine and gave myself the first injection. Somehow I automatically switched to operating mode, and from that point on, I didn't notice anything else. End quote. The most impressive thing is that somehow the totally real transcripts from that very procedure survived to this day. You guys imagine that?
Crazy.
I don't know, we keep getting lucky.
But wait. Of what happened. Yeah. Now I see it. Yeah. That's crazy.
Yeah.
Whoa.
Let's get to it.
Wow.
Do we have them?
Oh, right here. Dr. Rogozov begins his extraordinary autoappendectomy while his assistants stand by to help.
I will be entrusting my life to you two. I need you to hand me the surgical instruments as I call for them. This will not be easy to watch and let alone perform. If I should lose consciousness, please take care all efforts to revive me.
Yes, doctor. I wish you luck in this.
Yes, comrade, we are here for you.
Thank you. Please hand me the Novocaine so that I might anesthetize the skin of my abdomen before my incision.
Here you go.
All right, me. You are going to feel a little pinch, and then some pressure. Ouch! Son of a bitch! Why do we always say that to patients?
Are you all right?
No, I'm not all right. That hurt. Why do we always say pinch or pressure? It just hurts. The poke is one thing, but then the medicine burns, and oof! My skin, it's numb now. Okay, so give me a scalpel.
Here you go.
And now the operation begins with a single incision.
Comrade, what are you doing? What are you waiting for?
Do you need me to help?
No, I can do it. I'm just, I'm psyching myself out.
Okay.
All right, here we go. I didn't feel a thing. And well, look at that.
At what, doctor?
Look at my intestines. I mean, like, they're right freaking there. Like, I open my abdomen, and I'm touching my own freaking intestines.
It is pretty weird now that you say out loud.
I know, right? Okay, we continue. Now, angle the mirror down there. I'm looking for my appendix.
Oh, wait. Is that it? Right there?
No, that's my aorta. You see it pulsing. It's a major blood vessel in the body. An injury to that, and it would be dead in moments.
Oh, we should probably leave alone then.
Yes, I think it best to leave it alone. Let's see here. Hard to work with that mirror. I'll just use my hands to feel my way around.
Comrade?
Da?
There seems to be a lot of blood now. Are you all right?
Not to panic. I mean, we surgeons have a saying that all bleeding, it stops eventually. We will just tie that off here for a moment. Here we go. Less blood. Now we wait for my lightheadedness to pass. Okay, yeah, I feel better. Deep breaths. Ah, there it is.
The appendix?
Yes, finally, I will remove this cursed appendage.
Is it done?
It is done. Now I will sew up my abdomen and take a much needed rest.
Hey, comrade. Now that this operation is complete, I thought of something funny.
What?
In Soviet Antarctica, all bleeding stops you.
This is terrible.
I need the scalpel back.
Why?
It's not too late to reopen abdomen and cut aorta.
I understand. Man, I'm glad we have this seemingly endless reservoir of source material for these stories. Just seems like that procedure went flawlessly. But as you might imagine, some things do not go to plan, however. He had thought to use mirrors to see into his abdomen and perform the operation, and it seemed like an awesome idea until he realized he was doing surgery backwards and like upside down, and he found it to be pretty daunting.
Yeah, that would be hard.
Yeah, it's sometimes hard when you're right side up and forward, but then again, I'm not a surgeon.
Could have used two mirrors.
Yeah, that's what I was just wondering, right? Because one would reverse the other. Stupid Soviet
Maybe he was
surgeon.
a vampire.
Let's give him notes.
Sucks.
It's better than like a guy feverishly sketching what's happening.
Yeah,
See you
that'd be
inside.
awesome.
It's like 100 years before that's how they did it.
It looks like a worm appendage. I think that would be appendix.
So he switched to manual mode. He just took off his gloves and he just felt around in there until he felt the structures where he thought they should be, and you know, that's pretty hardcore. I mean, that's probably the most metal thing I can think of in this instant. You cut open your own abdomen, reach in, grab your intestines. But then again, there's downsides, because if you're blindly going into your abdomen, he did manage to nick a bit of his intestine, though it says that he sewed it up, and he was able to stem a heavy bout of bleeding that started occurring as well. So he was able to tie off vessels somehow and actually stop himself from bleeding to death. And the best is something from Rogozov's journal. He wrote, quote, "Every 4 to 5 minutes, I rest for 20 to 25 seconds. Yeah, end quote. And he just described having lightheadedness and head spinning. And in the middle of all that, he was also worried that, hey, if he handled his appendix roughly, he might actually cause it to burst. And even though he's in there doing the surgery, that's going to lead to other problems.
Oh my God. So You know what this makes me think of is there's a description. If you really like, when you try to intubate somebody, you're trying to put a plastic tube around their tongue,
Putting in a
into
breathing tube is
yeah,
what you're
putting in a
saying.
breathing tube into their windpipe. And normally, you guys know this is something we do frequently, and you have a video view of it. You have the person's nice and sedated, and you can see everything, and it's beautiful. But they describe sort of a blind passage from the front, just using 2 fingers of one hand to feel the back of the tongue and the top
Manual
of the airway.
digital intubation.
Yeah. And then you use your other hand to pass between the 2 fingers that are feeling where you're going. And whenever I read that, I'm like, God, I would be so terrified to do that. I mean, just because what that would actually be like, just completely trusting your motor memory.
It'd be a nightmare.
Yeah, because
when you get to that point, you're already like,
yeah,
nobody's going to get this. So the standard of care
already
is fairly low.
That's true. You're probably, if you are at that stage, you should probably also be preparing the neck for a surgical airway. There was also, back in the day, they did blind nasal intubation. So you're trying to, what we try to do under a direct video to like look down somebody's, medically speaking, gullet and find their windpipe and then put a tube in it. It takes it takes practice, but once you get good at it, it's pretty repetitive, except for when you have a very tough airway. But you can imagine, like, there was a time when the way to try to get an airway in the emergency department was to put a tube down somebody's nose and basically hope that it blindly went into the windpipe.
Yeah. And apparently there's this thing where you would listen for a whistle.
Yeah,
like,
you listen.
Right. You would listen for the noise of change, and you would try to time it by hearing it and just stuffing it in the nose that it would probably get its way into the windpipe.
Or the chest tube. Kind of thinking gross noises. That's a gross noise.
What?
It's a satisfying
noise.
noise.
What was that movie? It wasn't American Sniper. It was the war movie. They perfectly described or showed a sucking chest wound. I mean, it was like absolutely horrifying. And
is that Three Kings?
No, the one with Marky Mark, Lone Survivor.
Oh, okay.
Yeah, so at the end, oh man, I mean, like
Marky Mark, his Funky Bunch didn't
like,
cover his
great
six
movie,
very well.
Terrible story, but like they did it. I mean, it was like spot on. So many movies are just like, they don't get that traumatic injury right.
So I guess the one thing you would say is a lot of our tasks are based on motor memory. So your hands do remember how to do this. I mean, if his hands are in the right location, I suppose he's probably done a bunch of appendectomies.
Just backwards.
So yeah. I mean, I could see
one.
where the backwards view would really mess him up. He's like, well, I'll just
see one, do one on yourself.
It's like some of my friends who play first person shooters, but they invert the controller so that up is down.
Mm-hmm.
It's insane. Well, I don't understand that.
Because
you're flying an airplane, that makes sense.
Yeah, but that axis is the barrel of the gun. So when you pull back on it, you're pulling the stock of the gun down. The barrel goes up, right? That's the way my brain thinks about it. And I'll just let you know that somebody was ranked in the top 50 in it was a Call of Duty. It was a Call of Duty a while ago. It was Hardcore Domination. I think it was for Black Ops 2. I was in the top 50 in the world. I played a lot of games back then.
So basically, triumphantly, he actually wrote, quote, "Finally, here it is, the cursed appendage. With horror, I noticed the dark stain at its base. That means a day longer and it would have burst," end quote.
Like 1,000 Valkyries screaming across the pale blue sky of Mother Russia. Is that?
Yes. That's, that was, I didn't include it, but it was later. I'm almost sure of it. So the operation itself took about 2 hours.
Pathetic. That's so slow. It's pathetic.
Well,
Oh, what's his face would be rolling over in his grave.
Probably a giant incision too, all messy.
Oh yeah, Dr. Liston would not be having that.
That's not a knife. This is a knife.
So as the article actually mentioned, Rogozov had the assistants wash up all the instruments and like get the room all tidied up before he took his antibiotics and sleeping tablets, and he returned to his work duties 2 weeks later, it says.
I mean, it's amazing. That is amazing.
Well, what were his duties though? He's a doctor. He probably just sat in the chair with his feet up on the counter.
You have cold. You go home. You drink vodka. Don't bother
Everybody
me
who
anymore.
came into his office after that, he would just be like, I took out my own appendix.
I
have
cannot log into
sniffles.
computer. I cannot care for a patient without. I don't know how to. Do you draw blood? Why would I do
Where-
no? There's no triage summary.
Where do I click? You say click here, right?
Son
What is
of a-
the score?
Now I
What
can
is-
dictate
what
with
is
my
this?
cellular phone. God, medicine is rapidly changing. I'm retiring. I hate it. It's too much. Now we have to work 9-hour shifts. The hospital is always full. Everything is protocolized. I don't even think anymore. I just click buttons.
The truest words ever said about medicine.
I long for the days of cutting into my own abdomen.
Do you remember when you used to ask somebody to page somebody and they made a phone call for you? Those were good old days, comrade.
Oh, God. I'm dying a little inside hearing that out loud.
Right?
So, as you might imagine, the success of the operation was a victory for Soviet propaganda, as well as Rogozov, living through it. Since Gagarin had just returned from space 18 days prior to this, he and Rogozov were also of a similar age. They were basically held up as national heroes. Rogozov won the Order of the Red Banner of Labor, which sounds like a prestigious award. I don't know much about Soviet awards off the top of my head.
He gets to stay in the nice gulag.
I don't think he went to Gulag. That being said, Rogozov is described as really not being a guy who wanted to be in the limelight. He went back to the hospital and the way that they describe it, he went back to the hospital and he restarted training. I don't know what the after med school system was like then in Soviet Russia, but basically he goes back to Leningrad and he just picks up the next day when he gets home from Antarctica, like, okay, I guess I do this again now. In September of 1966, he published a dissertation called The Resection of the Esophagus for Treating Esophageal Cancer. I don't know if you've had a chance to peruse it, but
Was it a do-it-yourself guide?
Just imagine if he was on Instagram now.
oh,
Or TikTok?
Everybody, take my nutritional supplement and take out your own appendix. Here you go.
I think you really settled into that accent.
It's
We're
yeah.
not going to be able to get Mike out of it again. He's stuck
You have
there.
to hit him on the left side of the
It
head.
used to
and then he
be. It
stops.
used to be that all my accents turned into like terrible Russian accents. Now they turn
was
into
before they went to
Scots-
Australian?
Scots-Australian, yeah.
Australian, yeah, that's fair. So from 1986 to 2000, he was the head of the surgery department of the St. Petersburg Research Institute for Tubercular Pulmonology. And he died in 2000 from lung cancer. So, I mean, Rogozov's trip to the Antarctic and his actual survival was kind of a hell of a story, which got me to the Googles. And I had to wonder, how many autoappendectomies do you find if you put that in? So it turns out he actually wasn't the first, although you don't find a lot. In fact, I found one other person who can claim to have done this. And that title goes to Dr. Evan O'Neill Kane in the U.S. in 1919, before auto surgery was cool, I guess. So yeah, it's actually, that guy, as I stumbled into it, probably deserves his own episode. You might ask, why did he do it? He was not in the Antarctic. He just kind of thought that the whole general anesthesia thing was a bit overblown and that he could probably do most surgeries with local anesthetic. Sounds terrifying, but at least he was like, I'll just take out my appendix to show you. And he did, apparently.
There is a local story about a local physician at a hospital not too far away, an older guy that had done his own vasectomy.
That I could see. I
Mhm.
mean,
Yeah, I
could
mean,
kinda see
what
that.
I heard, there was an article written about this, and whether or not you do it yourself or have a urologist do it, it doesn't make a vast difference.
Oh, you know all the
It
non-medical.
was such a
folks
long
are
setup
like,
Oh,
for that
what?
joke.
But the joke happened naturally because it actually, the story is
Are you defending your joke now?
no, the
You're like,
story
wait,
is
no.
true.
Just
Not
let it
necessarily-
exist as it is.
No, not necessarily that I believe that it happened, but the story that he did that is something I'd heard.
Okay.
The
I'm
joke
not
just
an,
kind
Heard
of
from a guy.
materialized. Yeah,
not an expert, but I think a lot of resource poor settings they do it with ketamine, and local anesthetics. Or I, I mean, I can see there's probably a lot of ways to do this.
An appendectomy.
Oh, just surgeries in general.
Yeah, no, and in fairness to the other guy who did his own appendix, he probably deserves his own episode. He had a lot of very strange, like curmudgeonly dismissive theories about medicine, and he did not sound like a nice overall guy or role model, but
sounds like
a crazy
perfect
figure
material
in medicine.
for our show.
So I guess it's kind of bread and butter.
Yeah.
So what do we learn from all this? Take out your appendix before you go to frozen wastelands. Many governmental agencies, such as the Australian Antarctic Division, that have outposts down there in Antarctica, actually recommend or insist that people going down there for long periods of time have their appendixes removed prior to the trip. There's a settlement with even longer term residents in Antarctica called Villas Las Estrellas. And people, it's run by the government of Chile, and people will be down there for years at a time. I think they said there's like 100 people typically living there at a time. But if you go down there, they remove your appendix, or you have to agree to have your appendix removed, and that goes for your kids too. So if you take kids down there, they take out their appendixes so they don't run into this problem.
That is so unusual. There could be any number of things that would cause these people problems. Like that's the one thing they're hung up on.
Well,
probably because of Rogozov. Yeah.
Well, I know from this one story honestly,
before surgery and antibiotics, this used to kill a lot of people, though. I mean, didn't it kill Houdini? I mean,
I thought he drowned in a box.
I got punched in the stomach and ruptured his viscera.
I thought he ruptured his appendix. Anyway, it was bad, right?
The
gallbladder, right? The gallbladder will also kill you.
Yeah,
quickly,
take that out too.
But that's a much more complicated surgery.
No.
And there's a lot more side effects.
He did die of peritonitis secondary to ruptured appendix.
Yes.
Nice.
Never mind. Well, with all that,
you should have done a Dave Coulier skit.
Who's Dave Coulier?
Full House. Remember, he was like, "Cut it out."
He's a Red Wings fan. I'll do it.
He was, yeah, and a John Stamos fan, and a John Cena fan.
I think
you can't see him.
John
Stamos. We're way out in left field right now.
We are. But with that, I would like to credit the BBC article that I read about this called "The Man Who Cut His Own Appendix." The Man Who Cut Out His Own Appendix, written by Sarah Lentati. And I took a lot of the details from that article, which was quite well written, nice and succinct. Also did use Wikipedia and a third BBC article about that village we talked about. So with that...
can I just interrupt real quick?
Oh, by all means.
We have airplanes, right? Is there anything that's preventing these people like from bypassing that 36-hour boat trip and then doing like a 2-hour flight? Do they not have an airstrip? Is it difficult? Is it the weather? It's the weather.
Okay. The weather, at least as described in this article, the weather is a big limiting factor for planes to be able to land. And it sounds like there's like a 2-month window when this typically happens, like people go in and out.
Now, again, the Earth is flat, so can they just fly under the Earth and then go to the other side? What's stopping us from doing that?
I don't know why they don't do that.
Oh, God. People are so stupid.
They need to find the giant buried alien base down there, and it'll be warmer down there, and then it's advanced technology they can.
Yeah, that's where all the dinosaurs are.
Yeah.
They die and then they float to the surface of the flat Earth.
What is happening?
Once all the pyramid forms, right, where they made the pyramids from the alien base in Antarctica.
But inside the Earth, on the other side, the pyramids are upside down. Everybody knows that.
Everybody knows this. Everybody knows.
The Illuminati, look, the pyramid upside down. We're on the right side of the Earth today.
That is all we have for today. We appreciate everyone listening. If you would like to send us a message or provide feedback, we can be reached through our website, www.poorhistorianspod.com. There you can find links to our social media sites. We take emails at poorhistorianspod@gmail.com. And if you're old-fashioned, locate a piece of paper, write down your thoughts on it, fold it into an envelope, write Poor Historians Podcast on it, and give it to your mail carrier. They'll figure it out. Probably. Until next time, signing off.
No, I will refuse to give up. I will not listen to this appendix rupture.
No, you went Schwarzenegger. You can't go Schwarzenegger.
I will not be restrained to this fight. I will not survive this, comrade.
Yes, doctor, you are getting delirious.
He's got to retake that.
No, I refuse. Okay.
Like,
No,
I can't
refuse.
fix that.
I will operate on myself. That was Borat.
That was
Oh,
good.
you're leaving it though. You just pick up from there.
I will do better with next jokes.
Hopefully, I will be dead by then. Aaron, that was really good, but then you went like Norwegian, and that's when I lost it.
You could actually hear the
there was a
wheels
little
coming
drift.
off the wagon.
There's a little drift there. Some accent drift.
I already apologized in the beginning, so the disclaimer should cover everything.